Welcome! We would like to present to you a presentation completed for Nursing 737, Interdisciplinary Leadership and Role Development for Practice Excellence. The program is entitled Rewards and Recognition, Challenges for Today's Leaders in Efforts to Motivate Staff. This presentation was completed by Susie Baskin, Tara Bortolfo, Latanya Johnson-Young, Rachel Lee, Kennon McCollum, Rosaline Okoro, and Bill Wagner, all from the University of Alabama Capstone College of Nursing. The components of this program include discussions regarding today's current economic environment with an emphasis on job-related changes that have an effect on nursing professionals in terms of recognition and reward for performance as well as patient satisfaction. It is our hope that this presentation will provide an overview and summary regarding the problems related to compressed pay ranges and limited dollars for compensation and recognition in nursing. We also hope to provide a perspective on global concerns regarding economic change and nursing worker satisfaction. And finally, we hope to discuss strategies and methods to improve nursing performance through alternative reward and recognition programs. Magdoff, 2011, in a recent article entitled The Jobs Disaster in the United States, explains that recent changes in the U.S. economic and employment environment has led to a loss in the current number of available jobs, created stagnation in the development of new jobs, and resulted in job loss for many people in the United States. Magdoff further emphasizes that additional negative effects of the current economic recession within the United States has created a sense of job insecurity that has led to a decrease in pay, a decline in the incidence and amount of pay raises, and has compressed salaries throughout many companies within the U.S. to lower levels than previous. LG 2007 summarized that our current healthcare system is in a state of disarray and that healthcare workforce shortages often influence and compromise patient care. In the year 2000, there were 1.89 million nurses, with a demand for over 100,000 additional nurses throughout the United States. It is projected that these numbers will only escalate in the coming years with a quadrupling of the nursing shortage by 2015. LG further summarized that it is becoming increasingly difficult to retain nurses because of negative physician behavior, flat salaries despite inflation, long work hours, and job inflexibility. Due to the international nursing shortages, LG further summarizes that the United States is unable to recruit from other countries to make up for nursing deficit as it has done in previous years. A major nursing workforce restructuring must be undertaken to secure current nurses and recruit competent and committed individuals into the profession. In 2003, Congress passed the Nurse Reinvestment Act of 2002, an omnibus appropriations bill to recruit and retain nurses. However, the profession continues to struggle with meeting nursing demands. Nurses are experiencing burnout. This is often due to work demands and feelings of inadequate recognition. With the baby boomer generation reaching retirement age and decreased young people choosing nursing as a profession, there will not be enough nurses to supply the care to those who are desperately in need. Statistics have shown increased risks such as poor patient outcomes, increased morbidity and mortality, higher nurse-to-patient ratios, and an escalation of adverse health events when there is not adequate staffing to accommodate most patient needs. Due to evolutionary changes in the national economic environment, it is not always feasible for nurse managers to recognize outstanding staff nurse performers with additional dollars and increased monetary compensation. Additionally, monetary rewards usually are often governed by rules that apply to organizations as a system. This often leaves the individual manager little room for rewarding individual employee contributions in the form of pay raises and salary increases. As a result, an effective nurse manager utilizes recognition and good performance as a motivator for nurse morale, job satisfaction, and to encourage staff retention. Historically, nursing recognition was provided primarily by physicians and nurse administrators. However, in today's healthcare culture, physician approval is now less valued, and nursing administrators are more removed from the unit level. As a result, alternative means of recognizing staff nurse performance has become a priority for most nurse managers. Cronin, Nones, and Beckerer, 1999, found that in the past certain professional activities were used as a basis for financial recognition. These often included specialty certification exams, educational advancement, and committee membership. These financial reward programs were reported to translate to cost-saving changes in practice, improve recruitment, decrease registered nurse turnover, increase job satisfaction, and increase job motivation. Review of the current nursing literature reveals that because of changes in healthcare today, an effective nurse leader must recognize that monetary and financial rewards are not always possible, and that nursing managers must understand that staff members are motivated to perform well when they receive public recognition, peer reinforcement, senior management appreciation, verbal praise, and are actively involved in peer recognition programs such as team building and morale boosting exercises. Porter, O'Grady, and Malik, 2011, discussed the fact that performance measurements must be based upon productivity, cost effectiveness, and the quality of the work delivered. Quality indicators should be based upon both customer and employee satisfaction. High performers should receive increased compensation and remuneration for higher quality of work when delivered. This compensation may be in the form of both monetary and non-monetary reward or recognition, whereas poor productivity indicators are often based on high turnover, disgruntled employees, and dissatisfied customers. In contrast to high performers, the mediocre or underperforming employee can seriously damage or malign the efforts of any organization. A mediocre employee often does the minimum amount for the job, takes more time to complete tasks, spends more time away from the job, and according to McCollum, 2009, is often less obvious and is perhaps more difficult to identify than the high performers within an organization. In contrast to high performers who are deserving of compensation and recompense, mediocre performers should receive decreased recognition and reward when failure to achieve expected standards for performance and behaviors is repeated. When the underperforming employee is identified, it is imperative for an effective leader within an organization to act quickly to enact specific and quantifiable action plans for improvement. Ongoing methods of encouragement from managers, supervisors, and organizational leaders, both formally and informally, are important to continue to motivate the individual to higher performance that is often measurable and sustainable. Employees who continuously and consecutively underperform should be recognized and warned of potential detrimental consequences to their continued underperformance when all efforts at motivation fail. Mediocre behavior, according to Mittal, should be dealt with in a manner so as to motivate, and if the employee fails to take ownership of improvement, then consequences should follow. In evaluating current non-monetary rewards and recognition programs, Bolster, 2007, proposed the 5-Star Service Recognition Program. The tenets of this program include recognition cards being made available for evaluation of services and satisfaction from customers and fellow employees. Each card has a section for comments and has a 5-star rating on the card for recognizing high performance. 1 star indicates lower performance and 5-star indicates optimal or maximal performance. Management often reviews and delivers each of these 5-star cards to high achievement employees and thanks them in front of other staff in an often open forum. The premise of the program is that receiving and completing 5-star cards helps to develop strong working relationships within the team. In utilizing various non-monetary rewards and recognition programs, there are many efforts that can be made to enhance recognition. Our proposed program will include a recognition trophy that will be passed to consecutive recipients on a monthly or quarterly basis, a certificate that can be displayed to remember the employee's recognition and appreciation from their peers, an employee parking space that will be located close to work, near the entrance, and will be used by the 5-star quarterly winner. In addition, an article will be written to showcase the employee's dedication to patients and peers in an organizational newsletter or publication. Job satisfaction of healthcare professionals is a complex variable that influences recruitment and retention of staff in all areas of healthcare. Specifically, job satisfaction affects the quality of life of the provider and can ultimately have an effect on patient care. For our program, objective measures will be used to determine its effectiveness. Employee satisfaction will be measured through the use of employee satisfaction surveys to be conducted before implementing the new program, and again at intervals of 3 months, 6 months, and 1 year following its implementation. The survey will include multiple metrics such as satisfaction with rewards of the new program, impact of the new program on feelings of recognition for going above and beyond, In addition, employee turnover rates and the number of sick days used by employees will be evaluated at the same intervals and compared with the numbers from the previous year. A study by Molyneux and colleagues in 2011 reviewed in the American Journal of Nursing found that patients are more likely to be dissatisfied with the care at workplaces that have higher percentages of dissatisfied nurses. This data shows a relationship between job satisfaction and patient outcomes and has possible implications for quality of care. Objective measures will be used to determine the effectiveness of our program on our patient outcomes, including patient satisfactions, rates of nosocomial infections, numbers of falls, as well as additional metrics related to adverse patient events. This data will be compiled and reviewed to determine if course of corrections are necessary. In summarizing our proposed program, it helps to reorient with 4 basic reality checks. First, today's economic and healthcare environment is in turmoil. While the turmoil in healthcare is easily identified with the current and very exciting changes to the whole ecological healthcare system, we all anticipate that the next decade will bring about a hopefully wonderful metamorphosis in an increasingly complex and interdependent healthcare system. Ultimately, and again with all of our hope, faith, and hard work, healthcare's future will actually be a functional system. In the meanwhile, the nation's economic crisis slaps us awake with the first reality check: we are running out of money. And it is this hard fact that results in compressed salaries with little reserve for financial incentive programs. Also, despite a growing demand for more skilled nursing professionals to take on greater responsibilities in our changing healthcare climate, we are anticipating an increasing shortage of trained, patient-ready nurses to manage the task. This stark reality check reminds us that we are running out of nurses. The drying up of that wellspring of cash that was our free fee-for-service system, coupled with increasing demands placed on fewer nursing professionals, has compromised job satisfaction in nursing. This has led to increase in burnout, a decrease in job performance, and well-documented poorer patient outcomes as a result of the acceptance of measure of mediocrity as the status quo. The summary effect of this is the sad reality that patient care suffers. However, our otherwise bleak reality is also filled with the hopes and promises of nurses' greatest strength and character. Basic logic confirms that the promise of financial reward and independence are not the principal motivators for persons choosing nursing as a profession. Our job is to provide care, human comfort, and support. It is no surprise, then, that nurses are largely motivated by these same qualities towards which we strive for excellence. Our final, wholly positive and encouraging reality check is the one for providing the structural support for our rewards and recognition program, is that nurses value gratitude and recognition. Our team's proposal of the 5-star service recognition program recognizes that the quality of our work as nurses impacts our personal job satisfaction, our relationship to our peers, the collaborative success of our team, the health outcome of our patients, and the multidimensional success of our institutions. The non-monetary rewards integrated into the 5-star service recognition program acknowledge the reality and limitations of today's healthcare and economic environment, but deliberately build on the individual and collective strengths, values, and ideals of the professional nurse. While the 5-star program is inherently a progressive model to promote performance excellence, it allows for early identification of those individuals whose performance and contributions are either substandard or mediocre. The incentive program encourages supportive supervision to empower the individual's performance improvement, and its objective measures also reflect the person's effort towards this end over time. The 5-star program recognizes and reflects a nurse's relationship with their professional role, with their immediate team, with the patients and persons and their measurable clinical outcomes, and with the institution as a whole. Rewards and recognition levels reflect these interdependent relationships. Finally, the success of the 5-star program can be objectively measured over time by evaluating patient satisfaction and other objective measures of outcome. These include adverse and sentinel clinical events, the rates of nosocomial infections, just to name a few. Additionally, ongoing feedbacks from patients, colleagues, and management ensure that the 5-star program can self-sustain its momentum over time. And as with any new program, careful study of the objective evaluation data allows for further fine-tuning to improve efficiency and efficacy of the program. These are all based upon measurable feedback that is received. Thank you very much, and you will see reference list at the end of our presentation. Again, thank you.